Definitely, the predictive maintenance is much more required, especially after the pandemic hit that we have seen. Uh, it's definitely required because I've been working on predictive maintenance kind of projects from quite some time, which are related to Industry 4.0 kind of implementations. I've worked for a couple of clients at my company, but it it's very rather than to this industries, the first priority should be humans, and that's
Yeah.
where it's very much important, and uh, it's growing very well. But what are the key challenges that you see with IoT in healthcare? I'm sure, like, the data is one of the key issues. We don't know uh, uh, how the data might be exploited. When we talk about AI, that goes into a never ending debate. But uh, what are the other challenges that we are seeing, so that which is stopping us to reach the pinnacle of it, or what is it stopping for us, maybe? And also, I would like to know what is the pricing of it. What kind of pricing on average? I know it might be different for different devices, but is it affordable, is what is the question.
Yeah, good questions. So, is it affordable? Um, the answer to that, like many of these things, is it depends.
Hmm.
The reason I say that is because um, the management of, going back to my son, the management of um, people who have type 1 diabetes, you know, most countries in the world, with one exception, the United States, most countries in the world significantly subsidize the healthcare of people with type 1 diabetes. They subsidize the insulin, they subsidize the glucometers, they subsidize the visits to the healthcare providers.
Hmm.
And there's a very good reason for that. The reason they do that is because if they don't do that, then these people get sick, and they get
uh,
very sick, and then they get very, very sick, and then they go into a coma with something that's entirely preventable.
hmm.
And if the government just pays, a vial of insulin is like 40 euro uh, wholesale. It costs us 4 euros. So the government here in Spain subsidizes it, 36 euros per vial.
Oh, okay.
And a vial lasts a couple of weeks. So
Mhm.
that's not expensive. And my son consequently will grow up to be a healthy uh, individual capable of contributing economically to the country.
Yep.
So the government, the tax system are investing in him, and he will become a positive contributor to society. Whereas if they didn't pay for his healthcare, then he would be a drag, an economic drag on society.
Correct.
So, and that's why questions around the cost of healthcare are always fraught, because very often it's cheaper to pay for the healthcare rather than let the person become sick and then try and cure them, and then they become a drag, on an economic drag. So that's the issue around cost. What's the greatest challenge? There are a number of challenges. A lot of these things have to hit kind of a scale to be rolled out. Um, there's issues around data privacy and security that you alluded to as well,
Hmm.
and they're quite real. And I guess the other issues are around legislation. There's very little legislation around these things because the speed at which the technologies are rolling out is far faster than the ability of politicians to keep up.
Correct.
Uh, Too many of our politicians are accountants and lawyers, and too few of them are engineers, scientists, etc. So the technical expertise of our political class is sadly deficient, and we see that globally. It's a global issue. We see that in the pace of change of legislation, particularly with respect to technological things as a result. And also, to be fair, uh, a lot of doctors are have a tough time keeping up with the technological advancements as well. Um, Issues around AI. Um, I think AI is has got enormous potential in healthcare. If you just if you just think of the kinds of pattern recognition that AI can do, and the orders of magnitude faster than humans it can do it. We've seen teams in MIT develop um, AI, artificial intelligence, that can scan mammograms and detect breast cancer there 5 years ahead of radiographers.
Correct.
5 years ahead of
That
radiographers. I mean,
that's
that's insane. And the thing is, these AIs can read these mammograms or any kind of MRI scans or things like that, much faster and more accurately than human radiographers. So what's going to happen there is, let's say you have a hospital that does 1,000 MRIs a day.
mhm,
Well, it's extremely difficult for a team of radiographers to go through those scans and diagnose based on them. What's far better is if those 1,000 scans are scanned by an AI, and you know the AI scans 1,000 of them and says nothing, 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 nothing. Oops, not sure. You better take a look at this. And then 80% of them are checked by the AI and said, okay, these are fine. These ones have this. Not sure about these 100 over here. So could you take a look at those 100 for me? And
mhm.
that way, you've got 1,000 scans. Let's say 50% of them have a diagnosis, 50% of them or 40% of them are clear, and 10% of them are sent for checking by a human radiographer.
Got it. Got it.